few weeks ago I saw some photographs of what the department looked like before the work began, and the department's been totally transformed. It was amazing how much brighter the department is, how much smarter, how much more modern it all looks. And that's definitely the feedback we've been getting from patients.
We started working with the Trust when they were putting the bid together, and we got together some of our carers and people with dementia we were working with, and they came along and did some workshops here in the outpatients department as it was, and gave some feedback as to what would be useful changes and how it could be improved, and that all went together with the bid for the funding. And then we were involved initial stages with the design and the mood boards and the development of the design as to how it could be beneficial to people with dementia.
There are three really important changes that patients are benefiting from and are very obvious when you walk into the department. The first thing is the lighting. It is much better. Dementia patients do have problems with their vision, and that does contribute to disorientating them in an unfamiliar environment. So the second thing is the improved signage. It's much easier for patients to navigate their way around. And then the third most important thing that patients notice is the improved seating. It's colour coded so patients know which area they need to be in. It's also more comfortable than the seating we had previously. There are chairs included for bariatric patients and for patients with mobility and transferring problems, so there's raised seating available. And all of these are things that we didn't have in the past and are really important improvements.
I think people forget that dementia isn't just about memory loss. It affects people's communication and perception and how they can view details. And having an environment that's very confusing can really add to the stress, particularly coming into a situation like this. So having an environment where the lighting is thought about, the signage, the colours, just the difference between the floor and the wall colours. And there's been a lot of research on this, and so it's really exciting to have a project which is using that research in a practical way and putting a really positive spin on an environment that is friendly for people with dementia and their carers.
We do have to listen to our service users and work imaginatively with our partners in the third sector as well to achieve the best results.
I think when you have someone with dementia coming into this environment, if there are reference points of, say, old photographs of Darlington, if there's something that they can relate to, it can start a conversation that can then be much more meaningful to them, and it can build up a rapport with the consultant or whoever they're seeing. And that just helps, again, for the consultant to be able to have a more meaningful discussion with them, and for the person with dementia to feel more comfortable and being able to have a conversation that they feel they can partake in. So